morning, everyone, and thank you for joining us for the University of Arizona Campus Update. I'm Holly Jensen, Vice President of Communications. Today, Dr. Robert C. Robbins, President of the University of Arizona, is going to provide important information on the university's current status. He's joined by his trusty sidekick, Dr. Richard Carmona, 17th Surgeon General of the United States and Distinguished Laureate Professor at the university. We will take your questions at the end of today's briefing. If you have any questions, please feel free to raise your hand and put your name and news organization into the window, and we'll ask them in the order we receive them. With that, I'll turn it over to you, President Robbins.
Thank you, Holly, and good morning to everyone. Thank you for joining us. I've been extremely pleased to see our students, faculty, and staff begin and enjoy the spring semester, getting off to a good start. And I want to thank everyone for doing their part to continue limiting the impact of COVID-19 on our university community. I want to begin by thanking our university ceremonies team for putting on a wonderful celebration last week to honor the superstar recipients of our inaugural Outstanding Faculty Awards. We celebrated 28 scholars, scientists, artists, and teachers. They range from postdoctoral scholars and early career faculty members to our newest and highest level Regents professors. Our events team has become experts in putting on outdoor COVID minimizing ceremonies and events. And I'm very appreciative of their efforts to enable this new tradition of celebrating faculty members at every stage of their careers. This week, the university continues in-person instruction. We have continued to encourage regular testing, and our team running the in-person and takeaway test programs have done an amazing job to work to meet the demand driven by our students, faculty, and staff. I'm pleased that the federal government has offered 4 free at-home tests to every household in the country. That's quite extraordinary. If you have not yet taken advantage of this service, I encourage you to do so by visiting covidtest.gov. We have also issued updated guidance on isolation and quarantine, consistent with the CDC's guidance and informed by our public health faculty advisors, students, faculty, and staff. Please visit the COVID Positive Protocol webpage for details. I want to reiterate and emphasize our focus on addressing the health needs of the university community. If you have a positive test or even exposed to a confirmed case of COVID-19, please follow the guidance and take care of yourself so that you can recover quickly. Faculty and instructors, provost folks shared specific guidance on class modality via email before the semester began. Please work with your departmental heads and deans to make temporary adjustments as needed. For all employees, please consider your own health and risk factors, and if needed, discuss options for possible flexible work arrangements with your supervisors. We want to make sure if you're at high risk, please don't come to campus. Dr. Carmona will now share recent data and offer comment, and then we'll address questions in the question and answer session.
Thank you, Bobby. Good morning, everybody. Happy to be with you again for this new year. Can I have the first slide, please? So we'd like to remind you about the testing options that you have, the CATS takeaway testing that you can pick up the PCR test on campus and drop off your sample. And for PCR and rapid testing by appointment at the student union. Please be prepared to verify your appointment and show your Wildcat One Stop to check in at this test site. Next slide. Vaccine availability. Vaccines are available to all students and employees through Campus Health as they have in the past. If you have any questions, please look at the URLs there and call in and find out what the rules are to be able to access those vaccinations. Next slide. Most important here on this slide is we are still in high transmission. If you look, we're 10th highest nationally, but the virus is spreading very quickly. Important to note that although spreading quickly, it seems to be less virulent, but spreading much more. So I think the most important message with the information we have now, we're not out from this yet. We are still in the midst of a pandemic with a new variant, the Omicron, which is challenging us, and one that continues to spread. Good news is it appears that when you get sick, it's not as bad as it was with the Delta. And the problem is that it can still infect and can cause serious harm, especially in vulnerable populations. So we still need to be very cautious and take the appropriate actions to be able to reduce transmission. Next slide. If you look at our testing results and see where we are, most recent 11.5%, and the past 10 days at 10%, still really high. As you know, throughout the year, we've been very happy with our low numbers of positivity, but even in our total testing window, which has now been skewed because of the high transmission rate, we're still at 4% overall for the period from 8/2 to 1/20. Next slide. So if we look at our vaccination rates as far as Pima County and at least one dose, we're about where we are in the United States. The US is about 80% or so with at least one dose. We're very proud of the fact that most of our seniors have received at least one dose, as well as youngsters 18 and above. For the total for the state is about the same as it is around the nation. We still have about a third of the people that are not vaccinated. And of course, they're at increased risk, not only for themselves, but for spreading disease as they get it. So again, the message is to follow the rules for decreasing transmission, as well as do everything you can to be vaccinated. Next slide. So steps to protect yourself and others. You've heard this for the last couple of years. I'm sure everybody's expert in this now. Getting yourself vaccinated, test regularly. If you do test and you test positive, take the appropriate precautions. Stay home. Don't come to school. Don't come to work. Don't spread the infection. Any in your family that's been exposed to you, get them tested. And if they're positive, make sure that they follow the same rules. Then wear your mask when you're indoors. This is still one of the best ways to prevent transmission of disease. Next slide. So if you have any questions, our COVID ambassador team has been fantastic. You have a phone number and an URL there. It's available 7 days a week from 7 to 7. Please don't hesitate to call. We know that this can be confusing. We know that science changes periodically and new regulations, new rules, new guidance are put out, and that can be confusing for the average person. Call the COVID ambassadors and they'll keep you updated on anything you need to know to keep you and your family healthy. I think that's the last slide. So Bobby, I guess the message for me is that we're still in the midst of a pandemic. We're suffering from COVID exhaustion. Like most universities, we're going back cautiously and carefully as we have, and our numbers show that, what we put in place under your leadership has been effective, but yet we still need to be cautious because it's still out there, and we have to encourage people to get vaccinated because the more people that are not vaccinated, the more likely it is we're going to get another variant that can set us back.
Yeah, I think, we watch the numbers every day, and the hospitals are pretty much at capacity, primarily because they can't get enough personnel to take care of patients. And that continues to be the number one problem for our hospitals, is getting adequate numbers of qualified nurses, technicians to take care of patients. Moreover, I think having said that, we're in better shape than we were this time last year, because we do have a vaccine, and we've not shut down statewide elective surgery. So, the hospitals are doing their best to try to take care of everybody, but there are still plenty of cases that are finding their ways to the hospital. Luckily for us, not many people in our university community. And so that gives me some comfort in that we brought people back to campus, and we'll continue to power through this because I think it's going to go away pretty quickly. And as you pointed out, Rich, this Omicron variant is not as debilitating as even Delta or the original form. So I'm very appreciative to everyone for working together to continue to do our best to offer in-person classes, realizing that many students just can't make it to class because they test positive and they need to stay in isolation. And many instructors and professors can't make it to class. So the biggest lift, I think, in all of this is, it's a little easier to do either all in person or all remote, but this hybrid approach is very difficult. You've all been in meetings where there are people who are in person and then there are people who are on the Zoom screen, and it's not as easy to do. So I'm incredibly grateful to everyone for continuing to be resilient and power through this to hopefully get on the other side by spring break when we'll all need a big break.
I think one thing we can do to remind the listeners, both our faculty, staff, students, but also the community who's listening, if you're not feeling well, if you need a vaccination, if you need a letter to go back to work, don't go to the emergency room. Don't go to urgent care. If you can, go on one of these call lines, ask a nurse, ask a doc, use telemedicine, because each of you who show up that don't have anything critical are taking staff away from those who need it. And we really are understaffed across the whole state. Every health system in the state is struggling with this. So as much as possible, what we can transfer to telemedicine and other methods of communication with health providers to give you advice that will allow you to stay home and not go out and expose yourself or expose somebody else if you are sick would be really advantageous and help the system that's struggling right now, as President Robbins said, because all our staff are tired. They've been in this, invisible war going on the third year now, and they have families to take care of as well. And they're truly physically, mentally exhausted. So as much as we can do to take the burden off of them would be greatly appreciated.
Yeah, the other thing that seems to be emerging about Omicron, and I know it's not universal, but sort of the sine qua non of Omicron is a sore throat. And there's a lot of good data that nasal swabs are missing it because it seems to like to reside in the back of the oropharynx. So I think a lot of the tests that are being done at the U of A is looking at the difference between oral swabs, throat swabs, and nasopharyngeal swabs. So that's another thing that's a little bit different about Omicron than even Delta or the original variant.
Sure, and our gargle test would be good for that purpose. That It'll pick up that deep nasopharynx.
So, Rich, we didn't talk about this, but I'm just curious what the WHO or the CDC says about the number of people globally who've been vaccinated. I'm sure that's very difficult data to get out of developing countries, but you have any clue about how we're doing worldwide?
Yeah, in most developed countries, we see that we're approaching majority being vaccinated. The underdeveloped, it's very difficult to track because there's no infrastructure in many of those countries. Reporting is, but what we do know is it is a significant amount. There's 195 or so countries within the United Nations, and a good amount of those are in underserved, or at least parts of their countries quite underserved, remote, rural, wilderness. And the challenge, of course, is that's most important. We know it's a large number, and we know that the more they are out there and exposed, that virus has a place to continue. So even if we do well in the United States and the UK, Australia, New Zealand, in developed countries, if a good part of the world is still not vaccinated, that is a great opportunity to harbor the virus, continue to let it mutate, get more mutations, and eventually come back to us in another form. So hence, as there's a lot of debate going on now at the World Health Organization, United Nations, as to what is the role of developed nations in working together to ensure that we have global vaccination, not just taking care of our own. And of course, that at times becomes very divisive because countries, communities feel that they should go first. It's their tax money that's supporting this. Yet the bigger picture is one of the best ways to protect ourselves and the world is all of the developed countries, which is what's happening, pooling some resources and making sure the underdeveloped countries get vaccinated.
Yeah, I think that's a must because with air travel the way it is, people from all over the world travel to all parts of the world. So that it's a perfect transmission vector, the airplane.
Bobby, I think that it's worth mentioning again, and we have mentioned it before, polio being the premier example of that 50s and 60s where it was rampant and we saw kids on iron lungs and all. But, polio today is a reportable event. I mean, it's so rare because everybody in the world has been vaccinated, and as long as we keep vaccinating polio, as there are many philanthropic organizations who've taken it upon themselves to go to the remote areas of the world and make sure all the children get vaccinated. So it's very uncommon to see polio today. And that's what we need to do, make it very difficult for that virus to go any place. And it's always going to exist, but it's going to exist dormantly until it can come back and find a new petri dish, if you will, a human that will allow it to continue to replicate.
Yeah. Well, but I think, when I talk to the scientists, I go, how does this thing really end? And they point me back to, the 1918 pandemic, and it was about 2 years, maybe a little more than 2 years for it to get around the globe. There's different modalities of transmission then, or transportation then. Probably ships is how people got around because, the airlines that we have today obviously weren't in existence. Right. But I think we're coming up now on the 2-year anniversary and or we're in it and past it. So my hope is that by the spring, summer, late spring or summer, we'll be through the worst part of this. But as you've said, it's going to be around for years to come, more in endemic form than pandemic form. But, I think we've been lulled into this complacency by, nobody saw Delta coming. Nobody saw Omicron coming. And maybe there's another variant out there to say something.
Yes. Yeah. Well, I think you're right that what we're shooting for is to accelerate herd immunity, to have this become endemic. And then, as you know, many of our colleagues, including at our university, are working on ways to incorporate this coronavirus into the normal flu vaccine every year. So it would be just another virus that we have to protect against in our flu vaccines. But the quicker we can get it to stop mutating, the more likely it is we can get a better handle and get a vaccine that may work. So fortunately, there are a lot of thinkers out there that are trying to do that right now, but they need help from us to accelerate herd immunity. I always think of this in terms of Darwin. Darwin's going to win one way or another. The question is, how long is it going to take? It's survival of the fittest. That virus is trying to survive as hard as we are. And we have to create that symbiotic environment where the virus is still, it's endemic, but we protect against it with our vaccine, just like in polio. But, Darwin had it right, I think, when he said it's about survival of the fittest for all living organisms and any organisms, microscopic or otherwise. And that virus lives very, very well in a vat, someplace in some foreign lands. And it's not toxic in that vat. But when it moves from that vat to us, however it does, in what we call One Health approach now, more and more, or you think of all of these diseases we've dealt with in the last few decades and going back to the great pandemic in 1918, they all start in the animal kingdom. And then they work, even HIV is another example, starts in a chimp, in an ape, and then moves into the human environment. So we have to be much more cognizant of the fact of the symbiotic relationship between man, humans, and animals. And when we encroach on their environment or they encroach on ours, what happens? And what happens is exchange of these organisms that may not be toxic in this animal, but are toxic in us.
Yeah. So the final thing before we get to the questions, Holly, is, I saw some chatter over the weekend about, well, are we going to require a fourth booster? And I think that, as you say, Rich, it's probably going to be in the form of an annual booster for COVID-19.
I think you're right. And, a lot of people have been confused because, they thought that when the vaccines came out, they were going to get a shot, and then they heard more information. Well, you're going to need another. Oh, and now you're going to need a booster. I think where we failed was a narrative starting on day one to say, this is going to carry you for a while and we'll be testing. It may be that we'll need to give you a second or a third shot to get us through this. But to your point, if we can include it in the annual flu vaccine, that may be enough that you don't need boosters anymore. But this is all brand new. This virus family has been around for a long time, but the mutations are where we are today.
Yeah, even with, people I've heard over the years, well, I got my flu shot and I still got the flu. The thing doesn't work.
Right.
Well, there are breakthrough infections. Clearly, there are breakthrough infections. Even if you've are fully vaccinated and boosted, you can still get a breakthrough infection with Omicron. It's just going to be a lot milder, and you're not going to end up in the hospital and on a ventilator.
Well, it's probably worth mentioning, Bobby, as you know, that when the vaccine group starts meeting at the end of a given year, what they do is look at surveillance data for the year. What's going on all over the world? And then they start looking at geospatial relationships, travel, all of those things to model what viruses may go where. And then they come down to, really a very well-educated guess to say these are the most likely. So the vaccine is made against those variants, and usually it works. And that's why you have a varying degree of effectiveness. But then you have to remember that everybody's immune system is different as well. We all know somebody who never gets a cold, and we know somebody who gets 2 or 3 every year. There's variability in that. And that goes back to your exposure at birth and all of the antigens or infections that you're exposed to in life that ramp up your immune system to protect you for the rest of your life. As you know, one of the most interesting experiments over the last number of years was in women who get C-sections, and they noticed that the children tended to have more respiratory pulmonary infections, ear infections later on. And it was thought to be that when at birth, when the water breaks and the baby comes down, that fetus comes down and the birth canal, that's when their immune system kicks on, because the first inoculation is all of those bacteria, viruses, and whatnot in the birth canal. So if you do a C-section and that doesn't happen, you kind of theoretically putting the kid at risk because they didn't get that first burst to get the immune system started. And that's how important it is. Think about it, that Mother Nature never thought about a C-section when she was thinking through how are we going to give birth. And the perfect system is coming down that birth canal, the kid getting the first inoculation, immune system gets turned on. So experiments after have shown that if you do the swabs and inoculate the child with the birth canal's flora, that you can actually offset those risk factors. So it's just fascinating information that we never knew about years ago as to how this immune system actually works and the exposure to antigens. We know that kids that grow up in the concrete environment, the urban jungles, they tend to, in general, have less immunity. And the kid that grows up on the farm and is playing in the dirt and milking the cows, they tend to have better immunity in general, because of the exposures.
Well, once we transition out of these updates every week, I'm very excited about the center that Dr. Dake and the Health Sciences is establishing around not only just infectious diseases, but cancer, immunobiology, transplant biology, and immunosuppression, autoimmune diseases, and of course, infectious diseases. So I think it's going to be. I've always been talking about that the next thing in the life sciences is going to be the human immunome, just like it was the human genome 20 years ago.
Yeah, well, it's very exciting, Bobby. And the last week, Dr. Dake got us together. We had our first meeting, and we've been divided into subcommittees to start putting the whole program together.
So maybe we'll do weekly updates on how your immune system's doing to whatever the next threat is. Holly, I think if this is degenerated, we should go to the questions.
It was a fascinating segment. Thank you. I've learned so much. If you have any questions, please raise your hand now. I did get one via text that says, for those of us who are on campus, can you tell us where, and haven't received an N95 mask, can you tell us where we can pick them up?
Rich, I think I'll let you, that's one thing we didn't do is go through the mask discussion. So this is the perfect time to talk about, and for everyone who's never had an N95 mask, you know, I got questions at the legislature about how difficult it was to breathe in masks. If you've never had an N95 mask on, they're very, very difficult and uncomfortable.
Yeah. Well, the N95, K95, you know, these are masks that offer you the highest risk of rate of protection. And certainly for health professionals at risk seeing patients, we've always recommended that. There's no reason that a person can't wear an N95, but for many people, it'll be a little bit more difficult. The true N95 needs to be fit tested so that there's a nice seal around your face, and hence it provides you the best protection. For any of you who are interested, if you go online to CDC or just Google masks, there are very nice comparisons of the different types of masks and how they protect. As far as any questions as to our allocation, I think that calling the ambassador number will have some information. I don't have the most recent information on our allotment of N95s, but in today's incident command, we'll be getting an update on that to find out how many we'll be getting and when we'll be getting them.
So we could just say that right now you can get your surgical masks. Oh, do you want to go through those really quick, President Robbins, the difference between them?
Well, this is an N95. It's very stiff, very thick. This is the KN95. I'm having trouble seeing my camera here. That is much more comfortable, but certainly very, very effective. And then the surgical mask that I don't have one with me now, but those are all very protective. The N95s are really meant for there you go, there's a surgical mask. So the N95 is really meant for frontline healthcare workers and people that are in very dangerous situations, even in hazardous spills and chemical spills and things like that. So these things are very uncomfortable after a short time to breathe through. But there are plenty of people who are every day on the front lines in hospitals working with these, and it's exhausting. They have to take breaks and actually take it off and breathe. So those are very stiff. These are, we have plenty of these KN95s. So that's what we're recommending, this and the surgical mask that Dr. Carmona showed.
That's right. And the surgical masks are available in all classrooms and building entrances. And if anybody wants a KN95, they can go to their building managers and ask for one, and or their supervisors can go to the building managers and get them. And I think there's a good supply, like several 100,000. I think so. Yeah, I think we have 150,000 on order as well. Our next question comes from KVOA. Are you afraid that some people are coming back to campus with symptoms on day 5 because there aren't enough options for remote learning? And how has mask enforcement been going? Yeah, I'm always concerned that people may be coming back too quickly. And the mask enforcement has been going well in the classrooms, remarkably well. I'm very grateful to everyone following the rules, and on the rare occasion when someone comes into a classroom, as I've been told that people have been very compliant when asked to put a mask on, because we have masks
in every classroom, in every building, as you said, Holly. So that part has been going well. In McHale, the women's basketball fans have been exemplary. The men's crowd, not so much, but they're getting better. I've noticed more and more people are wearing their mask at the men's game, and we really want to continue to increase that number. As far as coming back early, I think there are adequate testing places, and so if you've been positive, or as Rich was saying earlier, you know, if you hear hoofbeats in the night, it's usually a horse, not a zebra. So if you've got a sore throat and you've got fever and you're not feeling well, you probably got COVID. Okay, so take the precautions to isolate and get tested. And we'd love to see everyone who has been sick get a test to confirm it, so the time clock can start on isolation, and then get a test before you come back if you're coming back early.
Yeah. I think, Bobby, that even if they are symptomatic and say they tested negative, they have the flu, we still don't want you to come. Stay home if you've got the flu.
Right.
That's right. The other thing is maybe you two can talk about this, the difference between getting an antigen test at day 5 and a PCR test at day 5, because that's one of the things our scientists are looking at, the continual shedding of the virus in a PCR test.
Well, the PCR test is more sensitive. It takes a little longer. The antigen test, you get a result pretty quick. You know, you're just a few minutes. And so, and it's really probably the best screening for a disease when we have a large ground of people coming into campus health or the student union, wherever we're set up. So we will still use that as our primary test, but the PCR test is used as a confirmatory test. And again, it takes a little bit longer. You can probably, if you take a test in the morning, you may be able to get it by the evening. But again, the throughput is what's going to be the limiting factor with that. Whereas the antigen test, you get pretty much right there because of the color change.
Yeah, and the other thing is the PCR test can remain positive for a long time. Mm-hmm. So for instance, in the isolation dorms, after 5 days, which is CDC guidance, the students can test out of the isolation dorms. And for those tests, we're using rapid antigen tests.
It's also worth noting, if you take a test here on campus, you aren't, and you test positive, you aren't eligible for a PCR test again for 90 days.
Correct.
Yep. I think that, the other question that was at the end of the KVOA, sorry, is who is responsible for enforcing mask use for professors in the classroom?
The enforcement issue is a challenging one that we've discussed from the very beginning, because we don't want to put our professors or, TAs on the spot as to being enforcers. So what we've done is to do everything we can to encourage, inspire. And I think, Derek, our Chief Operating Officer for Athletics, did a great job. All of the security people now have big signs that they walk around with. And when they see somebody without a mask, they'll hold it up right in front of them and say, please put your mask on. And so we have had higher levels of compliance, but we want to make sure people understand that this is not a police issue, and we're not advocating for people to be dragged out of classrooms or things, because we recognize that in itself is very divisive and can cause more mental health challenges. We are doing everything we can to encourage people to cooperate, to wear a mask in those closed spaces.
Yeah. Well, I think that's all the questions we have for today. You guys got off easy. So I'll turn it over to you, President Robbins, for any final closing remarks.
Yeah, I think, I don't know if we're doing, are we scheduled to do one of these next week?
I'm not sure.
Yeah.
I don't know. I will confirm though.
Well, I'm hoping that by the next time we meet, even if it's in a week, we're going to see dramatic decrease in the number of cases, and we'll be on the road to getting through this latest outbreak. But again, from from the very start, even before we had the vaccine, I think the fundamental guiding principles of good public health hygiene have always been cover your face, wash your hands, stay away from people in close contact. And now the vaccine is just an incredible gift that we've been given. And so please get vaccinated. I know there's a lot of strong feelings from many people about not wanting the vaccine. And that's a debate that certainly is Dr. Carmona and I have discussed many times, that just didn't happen when we were kids and we were told to go get our polio vaccine. So I'm not sure how we got this far off track, but I would just encourage people to get the vaccine, and we don't want to see, more film or more stories about right before somebody was putting an endotracheal tube in, the patient asked, "Can I get my vaccine now?" Well, it's too late now. You're about to get this tube put down your trachea. So I would just encourage people, please continue to talk to your friends, your family, your trusted advisors if you're struggling with getting a vaccine, because it's one way to protect you from being in the hospital and being sick. So my hope is that we will see what New York City and the Eastern Seaboard is seeing, that this spiked really high and went down quickly. And by the next time we're together, we'll be in a better place. But until then, yeah.
Oh, I was just going to say the next time is February 7th.
Okay.
February 7th. Okay.
So soon. But until then, please bear down, vax up, and as always, mask up.